Hi, my name is Heather Zylstra, and my topic is on bubonic plague for microbiology. The pathogen bubonic plague is caused by Yersinia pestis. This is a bacillus or coccobacillus gram-negative bacteria, more difficult to kill because of their cell wall being harder. If gram-negative bacteria cell wall is disrupted, it will release endotoxins, making symptoms more severe. Optimum temp for growth of this bacteria is between 28 and 30 degrees Celsius, classifying it as mesophile. Y. pestis enters macrophages and neutrophils, but usually killed in neutrophils. The bacteria that enters the macrophage develops antiphagocytic capabilities, making it harder to kill. The bacteria is able to evolve, allowing it to invade host cells that are not phagocytic. Y. pestis disables the immune system and thrives inside and outside of host cells. The bacteria suppresses the immune system, causes infection, leading to death. And on the right is a Yersinia pestis bacteria, what that looks like. Transmission. The bacteria is zoonotic, meaning that it is transmitted from animal to human. Transmission occurs when a flea bites a rodent who is infected and then bites a human. It can also be spread from infected person to a non-infected person via droplets, such as cough or sneeze. The bacteria survives in the air for about an hour because it is killed quickly by the sun, but it can survive in soil for at least 24 days. Wearing long protective clothing when hiking, camping, and outdoors, or by using bug spray to deter fleas from biting can decrease the chances of transmission. Symptoms. Common symptoms associated with infections such as fever, fatigue, chills, muscle cramps, and headaches can occur. Symptoms that people experience that are more specific to Yersinia pestis includes painful swollen lymph nodes, so in the groin, armpits. They could be as large as eggs, and they are very, very painful. Lymph nodes play a big role in a person's immune system. So when an infection occurs, more blood cells rush to the lymph nodes to fight off the infection. The bacteria causes the fever, chills, and aches because the body's immune system is working overtime. It's working really hard to fight off the infection. And as previously stated, because the bacteria is gram-negative, symptoms become more severe when the bacterial cell wall is destroyed. Symptoms typically occur within 2 to 6 days of becoming infected. If left untreated, Y. pestis is fatal. Mortality rate varies depending on which time period, age, location, accessibility to healthcare the person has. And according to World Health Organization, mortality rate is up to 60%. Luckily, antibiotic treatment has made it possible for many to survive in current times. Diagnosis and treatment. Diagnosing a plague isn't complicated. However, most medical professionals in first world countries don't anticipate it being the diagnosis. Often the painful swollen lymph nodes are an indicator of the rare disease. If plague is suspected, samples of blood or lymph are collected and submitted to the lab for testing. Treatment is simple with common antibiotics specific for the presenting bacteria. So in this case, it's Yersinia pestis. 3 main antibiotics used are streptomycin, tetracycline, and chloramphenicol. These antibiotics are very successful at fighting gram-negative bacteria. Side effects of antibiotics can include nausea, vomiting, diarrhea, light sensitivity, pain, indigestion, and headaches. Possibly an allergic reaction can occur, causing wheezing, rashes, and anaphylaxis. The most problematic complication from common use of antibiotics is resistance forming and mutation to the bacteria, making it harder to treat. Reinfection of this bacteria is unlikely, but it can happen. Demographic and AI. Plague was introduced to America when a rat-infested steamship sailed in from the affected areas in the 1900s. Since then, small outbreaks have occurred, but in the past 20 years, there hasn't been more than 17 cases reported per year. Today, the disease is more prevalent in Africa than anywhere else in the world, which is shown in this picture here to the right. Artificial intelligence is being used with Y. pestis to detect mutation that can occur and will occur. Much of the AI research has been to improve treatment. However, it is unclear how much of the AI has been truly successful in treating Y. pestis. And that is my presentation. These are my references. Thank you.